Why are glucocorticoid receptors key to M treatment? Imagine a tiny switch inside muscle cells that can influence how well muscles fight off damage and inflammation. That switch is the glucocorticoid receptor, and it plays a vital role in treating muscular dystrophy. In conditions like Duchenne muscular dystrophy, the most common and severe form, muscle fibers become fragile and break down over time. Glucocorticoid drugs like prednisone and deflazacort activate these receptors, which then help protect the muscles from further damage. They do this by reducing inflammation, which is a big contributor to muscle deterioration in muscular dystrophy. When the glucocorticoid receptor is turned on, it triggers the expression of genes that help muscle cells handle stress better and repair themselves more effectively. One of the key ways these receptors work is by increasing the production of proteins like utrophin. Utrophin is similar to dystrophin, the protein missing in Duchenne muscular dystrophy, and helps stabilize muscle cell membranes. This stabilization reduces the damage caused by muscle contractions and stress. Additionally, activating these receptors boosts the expression of other genes like Krupp-Hell-like factor 15, which enhances muscle metabolism and endurance. This means muscles can work longer and more efficiently, even in the face of the disease. Another important aspect is the anti-inflammatory effect mediated by glucocorticoid receptors. Inflammation in muscle tissue accelerates damage, but when these receptors are activated, they suppress inflammatory signals. This results in less muscle breakdown and lower levels of serum creatine kinase, a marker of muscle injury. By calming the immune response, glucocorticoids help slow the progression of muscle weakness and preserve function. While the benefits of activating glucocorticoid receptors are clear, long-term use of steroids can lead to side effects like growth delays, bone weakening, and metabolic changes. That's why researchers are working on new drugs like vamorolone, which selectively target these receptors to maximize benefits and minimize risks. Clinically, glucocorticoids remains the main treatment for Duchenne muscular dystrophy because they can delay loss of mobility and extend life expectancy. However, treatment must be carefully managed by healthcare professionals to balance the positive effects with potential side effects. In summary, glucocorticoid receptors are central to muscular dystrophy treatment because they help reduce inflammation, protect muscle fibers, and improve muscle function. Understanding how these receptors work guides the development of better therapies that aim to slow disease progression while reducing adverse effects. Always remember, anyone considering treatment should consult healthcare providers to find the best approach tailored to their needs.